I'm Dr. Fairchild, and today we'll be speaking about homocysteine. Homocysteine is an amino acid that's metabolized from methionine and is involved in a lot of biochemical processes in the body. Homocysteine levels tend to increase as people get older, and there is a very strong connection between homocysteine and cardiovascular disease. Homocysteine affects multiple organ systems through multiple cells and is involved in a lot of disease states. What is annoying is that the major insurance companies still consider homocysteine experimental and refuse to pay for testing. And the other thing is that homocysteine just reacts with so many things through so many different pathways that it's really quite complex. But the good news is that we are not helpless against high homocysteine. There's quite a bit we can do, and quite a bit more even beyond the B6 and B12 that everyone already knows about. The commonly accepted lab reference ranges for homocysteine are wrong, and we have studies that show what the reference ranges perhaps ought to be. I will also be talking about 23andMe and how to go into their website and browse their raw data and find the results of specific SNPs. The diagram I sent is just a very basic overview of some of the things homocysteine can do. It affects a number of cells, including vascular endothelial cells and vascular smooth muscle cells, as well as circulating lymphocytes. And all these interact and produce oxidative stress and work to just cause really bad things to happen. The other thing that homocysteine does is that it causes hypomethylation, which then has some impacts in pregnancy. It's definitely linked with Down syndrome, as well as schizophrenia risk and congenital heart disease. And it's very important to test somebody's homocysteine, even in spite of the barriers put up by insurance. There are ways to get it done cheaper than going through Cholesterol LabCorp, which I will be talking about. And it's something that ought to be checked because it can be helped fairly easily.